Here we have a plain radiograph on 30-year-old female with history of long-standing bilateral hip pain. So on first look, the X-ray looks quite unremarkable, but if we look closely at both hip joints, they're abnormal. So what is the abnormality here and how to describe it? So what we see here is over coverage of the femoral heads by the deep acetabular cups bilaterally symmetrically. There is no evidence of acetabular retroversion because there is no crossover sign in both hip joints. There is mild sclerosis along the lateral edges of both acetabula bilaterally fairly symmetrically. There is no narrowing of the joint space, and these features are quite suggestive of bilateral femoroacetabular impingement of pincer type. There is no evidence of secondary osteoarthritis. Hence, this needs further evaluation by the orthopedic team for further clinical symptoms and signs of femoroacetabular impingement and proceed from there. So this is one of the commonly missed findings while reporting plain films. Femoroacetabular impingements are commonly missed, so we need to pay careful attention for this.